Hi guys, happy Friday. We're en route to London for one of our immersion courses tomorrow. I thought I'd do a really good video on PLAB 2 and 5 key questions or phrases to avoid in your PLAB 2 practice scenarios. Now I see a lot of people prepare for PLAB 2, mainly through our one-day communication skills course in Birmingham, in London, or in Manchester. But we also teach all this on our PLAB 2 online course and on our PLAB 2 audiobook courses as well. I'm an ex-PLAB 2 examiner, so I used to see a lot of this stuff as well. Now, we do a lot of work on communication skills, and a lot of these phrases are not things to avoid completely, but often it's the way that they come across that I think is much more important. They can come across as learned phrases, pre-rehearsed phrases, robotic phrases, and I'll talk about each of these as we go through the 5 statements. So let's go. So key phrase or question number 1, it's not actually a question or a phrase, it's just generally the way that we introduce ourselves in a PLAB 2 scenario. There's a lot of pre-rehearsed lines that I see, a lot of pre-drilled lines that have been said 1,000 times that just don't sound very genuine. Hello, can I confirm what your name is, please? Can I confirm what your age is, please? Can I confirm how you want me to address you? Now, of course, the principle behind all of this is correct. You need to know who that patient is. The patient needs to know who you are. And you've got to do that for several very correct reasons. But the way it comes out is often very robotic, and it doesn't set off a nice, relaxed, comfortable tone. It sets off a tone as if you're going to interview someone, which is not great for IPS, interpersonal skills, and general rapport. So, you have introduced yourself to thousands of people in your life. You have your own style, so you need to stick to that style. You need to be saying something that you said 1,000 times, because if you say something that you said 100 times that you've just learned, it's going to sound really, really odd. So just be natural. Hi, is it Mr. John Smith? Hi, I'm Dr. Aman, one of the junior doctors in the department. How can we help? Really natural, really relaxed, but yes, I know who they are, and I've confirmed who they are, and they know who I am. Even the line where they say, can I just check or confirm how you'd like me to address you? There's a few variations on this. You don't really need to do that. Like, we don't really do that in day-to-day life. You don't really do that in day-to-day life. And I get why you do it. You want to know, is it John or is it Mr. Smith? But to be honest, it's not something that I say you would need to do in a consultation. It's not going to change things. It's not going to build rapport. It's probably going to sound a bit awkward because the role player is not used to getting that kind of question. They've come with a problem, they've come with an issue, they want to talk about something, and we're going through this kind of checklist at the beginning just to kind of tick off a few boxes. So the first thing I would say to avoid in general is not having a too robotic introduction. Just go in, make sure they know who you are, make sure that you know who they are, and then get the consultation rolling in a natural way. So number 2 question to avoid. Very often I hear people say, may I ask you a few more questions about this? Now, this happens sometimes 3, 4, 5 times in a consultation. A patient mentions, doctor, I've had a bit of pain recently. May I ask you a few questions about that pain? Or next time, let's say, I've had a few difficulties at work. May I ask you a few questions about this? Or doctor, I've come in with a cough. May I ask you a few questions about this? Now again, I understand the principle. You want to almost let them know or get permission to ask a few questions. But remember, again, this person has come to see a doctor for a reason. They've come to see a doctor to talk about their problem. They've come to see a doctor expecting that they're going to have questions asked of their situation. So you don't always need to ask permission to get questions. Now, signposting is important. When someone comes in with a cough, you would tell them that when it comes to a cough, there's a few key questions that I need to ask. I'm just going to run through a few, but I don't need to get permission. Is it okay if I ask you a few questions about your cough? Because it just sounds a little bit odd, and remember, that's what the patient has come for in the first place. So to keep asking that question just sounds a little bit strange. And from a role player's point of view, from a patient's point of view, they're not really expecting that question. So signpost, yes, always signpost. And we've done quite a few videos on YouTube about signposting and how to do it correctly. So you can signpost throughout. Mr. X, I'm just going to ask you a few questions about you and your lifestyle. I'm just going to ask you a few questions about the pain that you mentioned. But resist the need to ask permission to ask certain questions throughout your consultation. So phrase number 3 to avoid when it comes to PLAB 2 practice, and I suppose this is more about don't do it repeatedly rather than don't do it at all, is the phrase, I'm sorry to hear that. Now, of course, showing empathy and sympathy is a really important part of interpersonal skills, and there are times and there are places where you need to use this kind of phrase. But often what I see when I'm practicing with people on our PLAB 2 course, for example, is that this phrase is again said 4, 5, 6, 7, 8 times in a consultation, and even for things where really you don't need to be sorry to hear this. So for example, oh doctor, I had a bit of a difficult week. I'm really sorry to hear this. I had a bit of pain last night. I'm really sorry to hear this. And I'm having a difficult time at work. I'm sorry to hear this. And you see, when you say it 3, 4, 5 times, the genuineness of it is lost. So it doesn't really sound like you're sorry to hear this because you're saying it for 4 or 5 things. And when your genuineness is lost and you say it more and more, it actually has the opposite effect. It shows that you're just saying words because I've learned that I need to say this, or I've been told that this is the right phrase to say. This is the right way to show empathy. And remember, when it comes to empathy, you guys have been seeing patients for a long, long time, and you've seen thousands of patients before. You know how to show empathy, and how you show empathy is different to how the next person shows empathy. Now, some people will have certain phrases that they use, but they will come across genuine because you've said them so many times, and they come out almost without you even thinking about it. You're a human being, and you see another human being in trouble or in difficulty, and you show empathy. You don't need to learn a phrase that shows empathy, because actually it could show the opposite. You know, it shows that I'm just saying it, going through the motions. I have to say the line, so I have to say the line. And when you say the same line 4, 5, 6, 7 times, and in places where you don't actually need to show empathy, then it starts to show that you're doing a little bit of a rehearsed job here, a pre-planned job, and it doesn't show the actual genuineness that you're trying to do. Now, remember, empathy may not even be through words. Sometimes just silence, active nodding, showing that you're listening, having good eye contact, showing that I'm here, I'm not rushing you. That can be just as empathetic as choosing a certain phrase. So if you're going to say phrases, make sure you do it naturally, and phrases that you do as you, not phrases that you've been told that are the ones that you need to do to show empathy. And certainly saying that I'm sorry to hear this repeatedly throughout 8 minutes doesn't do the job that you're trying to make it do. Phrase number 4 that I talk about in our courses to avoid saying at every possible opportunity, and again, it's not one that I say avoid completely, it's just one that's overused, I think. I'm just going to call my senior. Let me just call my senior. Let me get some advice from my senior. Now, calling seniors and talking to people who have got more experience than us, of course, as a junior doctor is really important. There are going to be situations where you're out of your depth. There are situations where you need senior help, and knowing the limitations of your knowledge and ability is a really important part in an assessment like this. But what I often see is that the senior is called at every little hurdle, at every little problem, at every little sticky situation, at every question that I don't know an answer to. Now, by the sounds of it, there are thousands of magic seniors running around hospitals who can come and help for every little situation or problem. Now remember, in PLAB 2, you are being assessed first and foremost. You're being assessed to see, are you going to be okay to basically work on a ward as an independent doctor? And you've got to show a little bit of lateral thinking. You've got to show a little bit of problem-solving skills. You don't need to have all the answers. You don't need to go beyond your limit, but you certainly don't want to be calling your senior for every single decision that you need to make, or every single question that is asked of you. So for example, if someone is really unwell, someone is acutely unwell, you start emergency management and you need to get a senior involved, that's absolutely fine, because you can't go taking on things beyond your capability. That shows that you're not safe. But say for example, a patient asks you a question, the doctor, I don't know, what can I do about my work problem? Now, we may not know the answer to that, but the reflex answer is, let me talk to my senior. Or if, for example, a patient gets a little bit demanding or a little bit annoyed or irritated in the role play, the first reflex answer is, let me get my senior, they can have a chat with you. Now, that's fine, but you've got to try a little bit yourself. You've got to think a little bit laterally. You've got to try and maybe control the situation. You've got to think a little about problem solving, and then maybe think about asking for a bit of advice from someone who's a bit more experienced. But remember, if you do go to a senior, it might be worth thinking about someone, rather than a senior, thinking about someone who may be able to help you specifically with that problem. So it may be that you have a bit of a chat to a radiology doctor. It may be that you have a bit of a chat to a neurology doctor, for example, or an ophthalmology doctor, depending on what the issue is or what the challenge is. And of course, if there's no one specific, then going to a senior is fine. But please just watch out for that reflex response. It's a reflex response. I see it so many times when we're doing our PLAB 2 immersion courses that the senior is called so many times. And if you keep on calling a senior and that becomes your reflex answer, then you're going to stop your own ability to actually think about a problem. And sometimes, you're better than you think sometimes. You can actually sort things out. If you have a bit of a think and try and work through things, set yourself first, you probably come up with some really, really good solutions and really good ideas. But sometimes that senior line is there drilled in so much that it kind of comes out of situations where you don't need it to, or a little bit too early, and before you even had a chance to show that you can probably do a little bit of this at the same time yourself. So watch out for that trigger line. Don't always say, let me have a chat or let me call my senior. So the fifth thing to avoid, and again, this is not something to avoid per se, it's the way that we do it, is when I hear something's gone wrong in a case, like a mistake has happened, for example, people often use the phrase, don't worry, we'll do an incident form, or don't worry, we'll do a significant event analysis. Now, it's fine to use these phrases, and I know why people are using these phrases, because they want to show that we're taking internal responsibility, we're going to look into what happened and improve our practice, etc., which is completely the right thing to do. When something goes wrong or a mistake happens, we want to show that internal responsibility that, we are going to take it on ourselves to try and improve practice. We're going to look into what happened, we're going to figure out what went right, what went wrong, we're going to figure out who was involved, and we're going to try and learn from whatever happened. But what happens is that the phrase that comes out doesn't demonstrate your understanding of this process. By simply saying, we'll do an incident form, or we'll do a significant event analysis, it doesn't demonstrate anything. It doesn't demonstrate that you know what that process is. It doesn't demonstrate that you understand the whole reason behind it. And it's not really going to give you, or it's not going to give the role player or the patient on the other side any kind of understanding as to what you mean by this. So what I talk a lot about when people do role plays and people mention incident forms and stuff like that is, rather than just saying the stock phrase, don't worry, we'll do an incident form, explain a bit about what you mean by the process. So, Mrs. X, look, I know things haven't gone exactly to plan. Now, when this kind of thing happens, we don't ignore this. We like to understand what happened. We like to, figure out how we can improve so that we make sure that this happen again. Now, we do this through something called an incident form or a significant event analysis. See, that's much better. You can use the term, but you simply don't want to just say, we're going to do an incident form, because that doesn't really demonstrate that you understand what that is. And secondly, it doesn't really explain to the patient or the role player on the other side how that's going to benefit the situation or why that's an important thing to do in that stage. So the general point about trying to avoid these things is, don't just use phrases that you've learned that you think are the right response to a situation. It's more the principle that you're trying to demonstrate that you understand. And one of the commonest examples is the term incident form or the term significant event analysis, but there are many others that I see in PLAB 2 where people have learned things that they need to say, but remember, it's more about the demonstration that you understand the reason behind what you're saying that is much, much more important. So that's it, 5 key questions or phrases to think about avoiding when it comes to your PLAB 2 practice, or not avoiding completely maybe, but changing the way you do it, being more natural and trusting your own gut instinct rather than learning pre-rehearsed robotic phrases. We do so much more work on this at our PLAB 2 Immersion Communication Skills Day courses in Birmingham, London or Manchester. So if your exam's coming up anytime soon, have a look at the dates, auroramedicaleducation.co.uk, and book yourself on one of those courses, or have a look at our PLAB 2 online communication skills course or our PLAB 2 communication skills audiobook courses as well. If you're watching this on YouTube, subscribe. The channel is Dr. Aman Arora. Much more videos like this when it comes to PLAB 2. If you're watching this on Facebook, like our page, Dr. Aman Arora. Again, so many more videos come your way through that channel. And if you're watching on Instagram, then please like our feed, Dr._Aman_Arora. Check out those feeds if you're not on any of those on our channels. I'd love to meet you at some point in the near future. You guys know the hashtag, can pass, will pass, hashtag I went with Arora. Have a good day.